All right. So, hello, everybody. Welcome to another episode of the Holistic Hub podcast. I am joined today by Dr. Todd Maderis. Thank you so much for joining us today.
My pleasure.
Yay. Well, I cannot wait to just dive into today's topic because it is something that is near and dear to my heart, just talking about mold and mycotoxin illness and just the different ways that it's impactful to our health, aside from it being just a chronic inflammatory response syndrome. And I know you've done a lot of research in this area, so I think this is going to be a really fun topic to dive into. I know I'm probably going to learn a few things, so it's going to be super fun. I'm really excited to chat all about it. But I think the first thing I'd love to dive into is actually just talking about what got you started in this space. I always love to hear every practitioner's story on just what got
Yeah,
them started in the chronic illness space.
sure. Yeah. Gosh, I guess, probably like a lot of people that end up specializing in a particular area, um, I started seeing patients that had been sick for a long period of time and, they'd seen multiple practitioners and, I was like the sixth or 10th person they had seen and they didn't, they weren't getting better. And, um, eventually I started to see people that had been diagnosed with Lyme disease. One thing led to another, and the next thing I knew, I was on a plane to a Lyme disease conference. And at the time, it wasn't as I remember thinking like Lyme disease, and I'm in California, so we don't think much of it out this way. But it completely changed my practice and the people that I could help. Lyme, of course, I think now we know this more than we did. This is over a decade ago that I got into treating tick-borne infections. But you know, now we call complex chronic illness, I think encompasses so much more than just chronic tick-borne infections, which are bacterial, but also chronic viral infections. And a lot of my patients also have a high environmental toxin burden, whether it's things like heavy metals or molds or other toxicants. So yeah, that was sort of you know the what tipped me off and got me into the tick-borne infections. And then with mold specifically, I was at a large international Lyme conference, and this was 10 years ago, and there was an infectious disease doctor speaking about mold. And I remember thinking, I looked at the lineup the night before the conference, and I remember thinking, like, usually every talk is, Lyme this, Lyme that, and someone was speaking about mold, and I couldn't figure out why he was at this conference. And it turns out that mold illness can cause a lot of the same symptoms as Lyme disease, and mold is very immunosuppressive, and so if people have had mold exposure and tick-borne infections, it's really critical to be able to pick up on the mold piece. And then that changed my practice completely. And it's been over 10 years now, and it's just been remarkable to look at all the various, I call them tacks in the foot. People have multiple causes to their illnesses, and everyone's makeup is a little bit different. You couldn't say that everyone has sort of um, the same causes of all their symptoms. And so, yeah, it's been a journey. And I think once you learn something or hear something, it's kind of hard to, it's hard to bury your head in the sand and pretend like it's not there.
Yes, absolutely. Because then it would just be in the back of your mind every time you're working with somebody. Like, what if this is the cause, mycotoxin illness, driving some of these symptoms that some of your chronic Lyme patients might be experiencing. So good for you for going down that rabbit hole because I know that this is what's led you to being able to speak at several conferences and being able to just discuss this on your various platforms to be able to shed more light into how mycotoxins can create and wreak havoc on our system. So,
Yeah,
yeah.
yeah. Thanks. This I recently spoke at um, summit, and I had the idea of putting together a little, one of my slides was a comparison of sort of immune response, which we call cytokines and chemokines in the scientific world, and various other um, mechanisms of injury, and compared tick-borne infections to mold illness and also heavy metals. And it kind of have I had fun putting together this graph, but essentially you know, every chemokine or cytokine that was elevated by tick-borne infections was also elevated by mold illness and heavy metals as well. So again, they all these exposures will contribute to this immune system dysregulation, and that's where people's symptoms come from. Um, so I think it's they're very similar in nature, and again, people rarely have one of these underlying etiologies. I mean, sure, someone can get a tick bite and within weeks or a couple months have symptoms, and that's a little more straightforward. But most of the people I see have been sick for 5, 10, 15 years, and I think a lot of times what ends up getting missed you know isn't the right treatment. People often look for what's the greatest latest thing. Do I need to go to Mexico and do stem cells, or is it some obscure therapy? And it's less about that, and it's more about that people haven't been properly assessed or diagnosed. And if there's something missing from the picture, then it's going to be a lot more difficult for that person to fully recover.
Absolutely. So, what are some of the more common symptoms that you see in your patient population in regards to someone that might be suffering from mold illness as a part of their picture?
Yeah, it's the symptoms can vary for sure. People can, the common ones would be things like fatigue, brain fog, headaches, anxiety, depression, insomnia, joint aches and pains. Sometimes we'll see digestive symptoms associated with mold illness, but kind of the gestalt of the common, chronic illness presentation. And then, of course, there could be more specific symptoms, or the mold exposure can trigger other, what I might call secondary manifestations, things like mast cell activation syndrome or POTS dysautonomia. And then there's a whole set of symptoms that come with those conditions as well.
Yeah, and I can't wait to dive into a few of those with you. But the first thing that I want to bring up is what are some of the routes of exposure that you typically see in your patient population to water damaged buildings? Is it schools? Is it workplaces? Is it the car? Is it their homes? Like what would you say are maybe some more of the more common areas?
Yeah, yeah, or all of the above.
Right.
It's like we talk about who's at risk for certain conditions, and when you think about mold illness, the punchline is basically everyone, because we all spend time indoors, and not that every building has water damage, but there's the some of the public buildings that you mentioned, like schools or government buildings, workplaces. Those there can be a risk of definitely seeing people who have been exposed in the workplace. Um, Obviously, people's homes are can be a risk factor as well, and people that we started to see more of this, especially during COVID, when people started working from home, and the next thing you know, people are spending 23 hours a day in their house. So things, I think if there's deferred maintenance or places that haven't been properly maintained, there's an increased risk of water damage. It could be the construction itself, like flat roofs or homes built into hillsides, any homes that have anything that's subterranean, any part of the house that's underground, like a basement or a garage. Um, I'm in Marin County, which is just across the Golden Gate Bridge from San Francisco, and in Northern California, we get, it's warm and sunny most of the year, but we get our fair share of rain. But there's also a lot of wooded canyons where homes were built, and so they stay in the shade quite a bit. Um, throughout the whole year, and a lot of homes are built onto hillsides as well. So I see, people that have had exposures that way. Yesterday, I saw a new patient who had been exposed to a brand new construction home that they purchased in Arizona a couple years ago. And so you wouldn't typically think of the desert as an increased risk of exposure in a dry climate, nor a new construction. However, in their case, it was the way the house is built, sort of the grading, the pad, and when they did when they finally got some rain in the winter, water basically flowed down to the house and then sort of seeped up through the foundation, which happened to be a concrete foundation. So it's you mentioned cars, another potential exposure there. It, it, you know, I also think that people can have it's like this woman yesterday. She was likely exposed in childhood too. She grew up in Denver, and her bedroom was in a basement, and she said every year it leaked. And you know, 20 however many years ago it was, 20, 25 years ago, her parents didn't think much about it. And eventually all they did was take the carpet out of the basement. But, water would flow down the walls in the wintertime. And so she probably had multiple exposures over the years, and which contributed to her current state.
I love that you mentioned the new home builds, because I'd say with a lot of the clients that I work with, they will, I know when I'm suspecting mold as a potential or part of their picture, that they'll mention, well, I'm living in a new build or a newly remodeled home, so I know it's definitely not my current state of where I'm at, right? And so, and I think that is definitely something that is misconstrued as being safe. And I mean, I wish it
That's
always was, but but typically,
well,
yeah.
yeah. I mean, I often joke that there's a risk with any home because of every in every wall we have pipes, right? And so pipes can leak. It doesn't have to be a faulty roof, leak in a roof, etc. It could be that a pipe. I've remember seeing someone whose a pipe had been nicked by a nail when the house was being built, and it took the homeowners about 2 years to discover that there had been a slow leak inside the wall ever since the house had been built. And so that it doesn't take much, or it could be a toilet that overflows or a dishwasher that leaks, even if it is newer construction.
Yeah, and what you had mentioned earlier about how someone's exposure could have been, or it could have been multiple incidents of exposure, or it could have been something that was 20, 30, 40 years ago, since mold
Yeah.
mycotoxins have the ability to just take hold and stay in our bodies for an extended period of time. And so is that something else that you typically find, is that it might not even necessarily be a current exposure? It's oftentimes something that you have to dig into the history and identify that they grew up in a home that had been experienced with water damage.
Yeah, yeah, or it could be what I might call successive exposures, and it could be, we see this with infections as well. I think that was some of the discussion with COVID, was people having successive infections. Someone might have Epstein-Barr, maybe it's dormant, they get COVID, it sort of reactivates COVID or the EBV, and then the next thing someone's symptomatic. And so it could be multiple insults over the years, and maybe why you see one or a couple, someone else in the house doesn't have symptoms, but this is the case with the woman I saw yesterday, and her husband was asymptomatic, but she's having symptoms. And like I said, she grew up in a house. She spent, it was like 17 years in this house in Denver, and her bedroom was in the basement that was very damp and moist, and then she gets another exposure just a couple of years ago in this house in Arizona, and it really tipped her over the edge again. There's a model called the 3-hit model, and I remember posting this somewhere, and we had a lot of comments and feedback and people saying, "Oh my God, that's exactly what happened with me." And it really could be any exposure, and it might be that someone gets Epstein-Barr in high school, and then they have a head injury in their 20s. They fall off a skateboard and hit their head, and then in their 30s they get COVID or they get Lyme or they have an exposure to mold. It almost it almost doesn't matter what the exposure was, but it's these successive exposures over time that contribute to the symptom picture. And then the bigger question becomes is how do you unravel that? Like you can, I'm a big fan of a mitochondrial researcher named Bob Naviau, who's at UC San Diego, and Dr. Naviau says it doesn't, you can remove the cause of the symptoms of the disease illness, and symptoms can persist. And that's part of it. I think we're starting to recognize that more and more with complex chronic illness, that it's yes, you can identify all these underlying pieces. And COVID was sort of the same way, right? Where something you can have that initial exposure that triggers the onset of it, and yes, there's a lot of evidence that these things can persist, but once that mechanism of injury starts and contributes to symptoms, as Dr. Naviau says, the road from chronic illness back to health is not the same path that got you there. And that's what gets tricky. But I think we're learning more and more about how to help people recover from chronic illness.
Yeah, and so many chronic diseases, as Dr. Naviau states in his model about how chronic diseases, the reason why a lot of there's just incomplete healing within the body, which is just allowing a lot of these chronic diseases to persist. And so oftentimes we can try to identify and treat what we're seeing, but if there is incomplete support to the damage that had been done to the system, then that is just going to allow the body to become vulnerable and in the ability for recolonization of whatever it is that may have been contributing to the symptoms in the first place. Do you see that quite a bit?
Yeah, it's sort of what we were talking about before we came on air about the how mold does contribute to illness and damage in the body, and one of the main mechanisms, we call it, is oxidative damage. And so and that's of course mold, and it's mycotoxins are what are causing that, but infections cause oxidative damage. Any exposure that contributes to this cellular damage is going to leave a lasting, or having a lasting effect on how that those cells function, which means that affects the tissue and then ultimately affects that organ, and how those organ systems function in the body. So you can imagine that I use an analogy of like running up we have Highway 1 is right out here at the coast, and there's some windy roads and there's a guardrail, and it's like you could run your car into the guardrail and scrape up the side of the car, and then eventually you can get the car home, and you come out in the morning, the car is still damaged, and so you can remove that insult, that original trigger, but the collateral damage that occurs from these exposures is what contributes to the persistence of the symptoms, and then of course interferes with how I always say, it's your cells that make up the tissues, and the tissues are what make up the organs, and that how you're only as healthy as the health of the cells, basically.
Yes, absolutely. And I'm excited to start diving into some of the different mechanisms of injury. You already mentioned oxidative damage. I definitely want to touch on that a little bit more. But kind of bringing the conversation to CIRS and chronic inflammatory response syndrome. So water damaged buildings has been now considered obviously a big root issue in CIRS, leading to that chaotic immune response within the body. And so with mold toxicity and water damaged buildings now, this is what you've done a lot of research in within the last couple of years, and discovering some of the other mechanisms that mold can create and wreak havoc within our bodies. And so you did mention oxidative damage, and I'm actually curious just to discuss a little bit more about that, but then also maybe talk about another few that had also stood out to you in your research. But alongside oxidative damage, um, does mold have the ability to deplete our bodies of glutathione, which is our body's master antioxidant?
Yeah, yeah. Unfortunately, it does, and of course, glutathione is so critical to protect the body from oxidative damage, and so, um, it's an interesting connection in that glutathione affects I'm sorry, mold and mycotoxins affect a gene that produces um, glutathione, and so it limits our body's production of glutathione, and then you have the mycotoxin causing damage to cells or oxidative damage. So it's a twofold approach in that contributing to illness, and that it creates the oxidative damage, and then it interferes with the production of the most important thing we need to protect ourselves from the oxidative damage. So it's a double whammy.
Yes, yeah, that's a good way to put it. So, what are some of maybe a couple other insults to the body that you discovered through your research that had really stood out to you that maybe you didn't even had realized beforehand looking into it?
Well, there's definitely a lot of immune system dysfunction that occurs from exposure to molds and these mycotoxins. And I guess when we talk about molds, we should clarify that there's also, um, water damage can produce bacteria as well, and things called, like actinomycetes. And, sometimes it's been referred to as a toxic soup of inflammagens. And so it's not just mold or fungal spores, but also bacteria. And the immune system, is greatly affected by exposure to these inflammagens, and so that you have a lot of inflammation that can persist. Which can also create, like we can see it affect even like the microglia in our brains, and so that's the immune system in your brain, where you might have inflammation. Um, I think a lot of times it does boil down to the oxidative damage that sort of precedes the next step. Um, Along the lines of immune system dysregulation, you might also see autoimmunity. Um, and then, when we look at some of the research, there's evidence that neurological conditions like Parkinson's and MS can be associated with mold exposure. And so that's probably related to this oxidative damage to nerves and immune system dysregulation as well, that causes that inflammation. So mitochondrial damage as well. Again, that mechanism's oxidative damage likely. Um, and so the mitochondria, as you know, are little powerhouses of the cell. Everyone remembers that from high school biology. And and back to Dr. Naviau's work, he would say that if these chronic illnesses are a result of incomplete healing, the road or the way to heal and repair from them requires energy, and so we do need sufficient mitochondrial function, and that to produce energy that's required for complete healing. So another one of those vicious cycle scenarios, in that if the mitochondria are damaged and aren't producing what's really the main currency of energy in our bodies, then we don't have that to heal and repair, and keeps people stuck in this, I call it's like a conservation mode, almost like when your cell phone goes on low power mode when your battery's running low. And that's what happens with the cells. So mitochondria are damaged. Um, and there's even some evidence that there's digestive, intestinal cell damage from mold exposure. We typically associate that with consuming foods that have molds, and then that contributing to like gut inflammation and what we think of as leaky gut syndrome. So there's almost every, organ system in the body is can be affected by mold and mycotoxin exposure. It's truly a poison and a toxin. And, you know, I used to, when you hear things like there's a organ transplant drug, a drug that's given to people that get, if they get a new kidney or a new liver, there's a drug called Cellcept, and it's derived from a mold toxin called mycophenolic acid. So, I think that demonstrates how strong these mycotoxins are and how much they affect. They're really a poison, and toxin to cells and organ systems in our body.
I know it's amazing the ability that mycotoxins and mold have on affecting almost pretty much every organ system within the body, which can, in some cases, make people feel like they're going crazy because they're having
Yeah.
symptoms in multiple areas. And one of the ones that you mentioned, digestive health, I think is starting to become more discussed now in the realm of mycotoxin illness. And I'm curious what foods that you typically see as contaminated, more so, I suppose, with mold that could be contributing to somebody's digestive upsets.
Yeah, I think it's an area of a lot of, there's probably some contention around this because, we would like to think that in our developed country that we're not consuming foods that have high mold content. I think a lot of developing countries have an issue. Grains in particular can be quite moldy, and oftentimes that's related to storage of grains in silos and then transportation of grains. Again, I think in developed countries that's less of an issue, and so sure we can have low level exposure from, you know, my blueberries the other day had some mold growing on them, and people talk about their coffee or other grains, and corn in particular, and a variety of things. And is it sufficient volume that is contributing to gut or intestinal barrier damage? It's hard to say. A lot of the research that's published, well, especially around the leaky gut connection. There's multiple studies out there that have shown the intestinal enterocytes. There's inflammation in leaky gut, but they come from the agricultural world, and a lot of it has to do with livestock consuming grains, and then affecting the livestock. And so there's a lot of research in the agricultural business looking at what they can give or put into feed for pigs or cows that, whether it's a binder or some other antimicrobial that kills mold before the cattle ingest it. So I think they're probably more at risk, and that's where a lot of that evidence comes from, and the research is from, kind of directed at protecting livestock.
Yeah, in another one, method of insult to the system that you had mentioned that I'd seen you talk about was actually mycotoxins' ability to damage the blood-brain barrier and then allow
Mm.
other toxic substances or environmental toxins, pollutants that we, come into contact with on a daily basis or whichever it is, contributing then to our toxic load. So do you see other environmental toxins kind of also playing a bit of a role in some of your patient population alongside mycotoxins?
Yeah, these agricultural and industrial toxins that are so ubiquitous in the United States are really difficult. It's difficult to test in humans, right? I think there's something like 100,000 chemicals in daily use in the United States, and very few of them have been studied for their effect on humans. And then as a clinician, there's very few tests available to even assess that in a patient. We used to have, there was tests that were available that were a little bit better, and those are no longer available. And there's a couple labs, sort of doing it now, but we have what are called persistent toxicants and non-persistent toxicants. And some things you just remove the exposure, like a solvent or VOC. If you remove yourself from the exposure or the exposure from the patient, then those levels would drop down. It's the persistent toxicants that we get exposed to that can have a half-life of like 40 years that stay in the system for a long time. So, things like heavy metals, lead and mercury in particular, I think are a lot more common than people think. Um, there was the EPA and another government agency, it's called ATSDR, Agency for Toxic Substance Disease Registry, created a list of the 275 toxins that are um, were at risk for humans are at risk for exposure to based on Superfund site locations and populations of people nearby and their potential effect, health effect on humans. And the top three out of those 275 are heavy metals. It's arsenic, lead, and mercury. And it's pretty shocking because, almost 300 toxicants and the first three are heavy metals. And, a lot of times people will say, my GP tested me for lead or mercury in the blood, or I did a hair analysis I bought off of online somewhere. And those aren't great ways to test. If you really want to rule out as a persistent toxicant, they stay in the system. In particular, we might see things like lead will get stored in connective tissue, ligaments, and bones, and so you have to mobilize the metal from those stored sites, and then capture it in some other fluid, because we can't go in and scrape the inside of a bone. So I use a provoked 6-hour urine test, and the urine is kind of a surrogate for what's being stored in the body. It's kind of how we measure indirectly.
We could probably do an entire podcast just on environmental toxicants because it's
Yeah,
just,
for sure.
and how you had mentioned, just not enough and not enough studies on it. I think it's like less than 1% have been tested for human safety or something like that. And yes, greater than 84,000 chemicals registered with the Environmental Protective Agency. And
Yeah.
again, you mentioning the top three, that was really interesting to hear, especially arsenic. So, to
Yeah.
my knowledge, inorganic arsenic is found highly contaminated in our water supply, but also in rice as well. And so I know that those are I'm assuming probably two areas that you mentioned as well um, along with multiple other areas to start to reduce someone's environmental toxic load, but definitely filtering water. And yeah, I think that's a big one for a lot of people.
Yeah, absolutely. Yeah.
Yeah.
And of course, not all water is contaminated. There's a map online that you can look at and see what, water in your area and arsenic content. And I rarely see arsenic in my patient population. Lead and mercury, by far, I see a whole lot more of that. But you'd mentioned the blood-brain barrier and breaching that, and I think what you might have been referring to is a proposed model of MS and the development of multiple sclerosis from exposure to mycotoxins. And the mycotoxins can breach the blood-brain barrier, create inflammation, and then it allows toxicants to more readily pass into um, the central nervous system and basically damage um, some of the neuronal cells, and then the immune system sees that and creates, sort of has an antibody effect against like oligodendrocytes, and then it starts attacking those, and that becomes the cycle where you get the damage, and then eventually can contribute to MS. At least that's one proposed model that I think I had included in the article you were mentioning. Um,
Yeah, that's very
and
interesting.
I've seen Yeah, I was going to say I've treated people that have, I think a better terminology, this, for your educated listeners and that are probably not, I think conventional medicine does a great job in a lot of areas, but, complex illness isn't one of them. And so when we talk about conditions that are caused by these exposures, whether it's infectious or toxins, I think a lot of times it boils down to those two things. Um, and so if someone has been labeled with MS, we and say it was caused by mold exposure, we might call it a MS-like presentation of mold illness, or if it was caused by Lyme disease, we might, or we would say it's a MS-like presentation of Lyme disease, and you can treat that. And I've seen patients that have, or sort of along that spectrum of MS, or have been labeled with MS, and you treat whatever that person's, at least what you find and suspect is contributed to their neurological dysfunction, and they can recover and get better, which isn't what we don't typically think to be the case in conventional medicine.
Right, right. I know it's always amazing what you can find when you start to just go after the pathogens or the toxins that are driving a lot of the symptoms and driving a lot of the inflammation in the system, and then the body has such a beautiful ability to be able to heal once those barriers are lifted, right? So yeah, it's just amazing what you can see in regards to healing. So yeah, thank you for sharing that. Another piece I'd like to, sorry, were you going to say something else regarding that?
Oh
Oh,
no, I just think it gives people hope to know that they don't have to, what you could call the disease drug model, right? In conventional medicine, we're good about putting labels on things, and it's sort of based on conventional medical training. Is what we have to do. We have to, there's certain characteristics of each condition. You remember the highlights of those conditions, and then the drugs that are associated with it. And so if you get the label of whatever the disease is, and then these are the drugs that have been approved or have been shown to help, but a lot of times they're treating symptoms, and so beyond that disease drug model, um, it's great for people to know that they can actually heal, and it isn't a life sentence that they're going to have that condition for. Had a conversation with someone yesterday about autoimmunity, and she has historically kind of been on this autoimmune spectrum, and having elevated ANAs, and then like her last blood work, her ANA was normal, and we were just discussing how it doesn't have to be, once. I think the mainstream belief is that once you have an autoimmune condition, you're always going to have it, and that's not the case. You can heal and recover from it, which is, I think it provides people hope.
yeah. And alongside that note, hope, I think, is one of the biggest things that needs to be a part of anyone's sort of healing journey or regimen or whatever it is, right? Because if you're not under the impression that you can recover from this, then no matter what treatments you do, whatever doctors you see, nothing will help unless you yourself have this hope that you can get through and see that light at the end of the tunnel, even if it's just a small amount. I always try to instill that too. I'm sure you do the same, but within my own clients, just that healing is possible and that you can take steps toward that. Yeah. So wonderful. I love that. I love these kinds of chats. So, I would actually, you alluded to this a little bit earlier in our conversation, and I would love to circle back to mast cell activation syndrome and mycotoxins in mold being a potential root cause for this. So I'm curious, in your patient population, how often you typically see it as a mycotoxin as a root cause for MCAS, and just curious if this is something that you typically see.
Um, well, I'm definitely of the mindset that mast cells, of course, are part of our immune system, and they contain these mediators. Your listeners may or may not know, but mast cells are the most common mediator that people know of is histamine, right? And that's what drives allergies in the springtime. But mast cells contain about 1,200 mediators, and when there's some sort of irritant pathogen, something that insult that triggers the mast cell to release its contents, then people experience symptoms, and they could be anywhere in the body, any tissue, and manifest with a whole myriad of symptoms. And I tend to be of the mind. Clearly, there's a condition called mastocytosis that's more of a monoclonal disorder, and the bone marrow produces excessive amounts of mast cells, and that's sort of a lifelong management um, issue. Whereas a majority of people have mast cell activation syndrome, and a lot of, at least in my patient population with complex illness, the attacks in the foot that the patient has are what's typically driving that immune system dysfunction. So um, maybe it's my hopeful, optimistic mindset as well that you can treat if and if you can properly address the underlying issue, that you can really improve people's mast cell presentation, right? Their reactivity. A lot of my patients that do have mast cell as a result of, potentially as a result of some other underlying cause, they tend to have a lot of, or be really reactive to medications and foods. And, some people can really get, almost backed into a corner where their life gets so small because they can't eat, many foods. They can hardly take medications. They're really, just, they have a very, their life is very, is reduced to very little, whether it's activity, foods, medications, etc. So, when I first learned of mast cell, I was, it really made sense when I applied it to my patients. And I learned about it from two of the leading mast cell experts in the US, if not in the world. And I'm part of a group of physicians that are mast cell leaders around the world, and I learn a lot from those doctors. And but I do believe that for a lot of people, if you can correct the underlying imbalance or cause, that it does improve their mast cell reactivity. And they may have to be conscious of, and sort of aware of exposures, whether, minimizing putting histamine containing foods in their body or knowing what their triggers are. But ultimately, people can go on and really improve their quality of life if an underlying trigger cause has been identified and addressed.
Yeah, and you mentioned how with a lot of these patients that are experiencing mast cell activation syndrome, their life has been reduced to so little tolerance to a lot of things in their environment, to where it's almost impossible to enjoy a lot of different things because they're unable to tolerate foods and environments and supplements and things like that might help them. So
Yeah.
I'm curious, because obviously it's important to identify the trigger and address that piece, but in certain cases, stabilization of mast cells is going to be also just as important before getting into, whether it's gently detoxing or removing said triggers. So what are a couple of your favorite supports or things that you have found really helpful in just stabilizing? I know you already mentioned, reducing some of those high histamine foods, and probably reducing, obviously, any environmental toxins or things that could be also triggering in the environment. But just curious if there's other supports you found really helpful.
Yeah, well, I kind of think of it as a spectrum of intervention. And number one, avoiding adding histamine to your system, right? So it's whether it's histamine containing foods or drinks, or histamine liberating foods or drinks. That's kind of a good starting point. You could even, speaking of etiologies, I also think like I see an interesting connection with some of my patients that have SIBO. And I found a great little study, because I think there was always this speculation of like what's chicken, what's egg, cause and effect. And at least according to this particular paper, if people have bacterial overgrowth in the small intestine, mast cells will migrate to the small intestine, basically there, and the lipopolysaccharide, triggers mast cell reactivity. The mast cells release their contents. That contributes to inflammation in the gut, or as we know it, leaky gut syndrome. And then once that occurs, it almost, I think it's a kind of a forward-feeding circle of events that occurs, because once the intestinal barrier has been compromised, then on the other side of that intestinal wall is your immune system, a majority of it. And then you get more immune system dysregulation, generating more mast cells, and you can, it becomes a little bit of a cycle. So even treating something like SIBO can be really effective, basically gut imbalance. And why do so many of our patients have SIBO? Is it because of you know, enteric nervous system issues, like we see with so many chronically ill folks that have, motility issues in their gut. So you see a lot of constipation, and that might predispose them to bacterial overgrowth. Normally we get this flushing wave, cleansing wave, I think is what it's called, that occurs, pushing bacteria downstream. But if that's not happening, if you're not getting that migrating motor complex, then you might see bacteria sort of, colonize in the small bowel. Or maybe we're not eating enough culinary herbs that we historically have eaten, like rosemary, thyme, garlic, these things that probably keep pathogens at bay in the small intestine. And so, that aside, identifying underlying causes aside, I really like using sort of the next intervention would be mast cell stabilizers. So things like quercetin and ketotifen, which is a medication that has to be compounded, but really excellent medication for stabilizing mast cells. Further down, treatment interventions would be antihistamines. You have H1 blockers like Claritin, Zyrtec, Allegra, and then you have H2 blockers that people will use. And then I think of, sort of DAO and enzymes is sort of the end of the line, because at that point the histamine's been, the mast cells have released their contents, and you're kind of cleaning up the mess after it's been formed. So if you can, prevent that from happening in the front end, I think that's preferred.
Yes, I really love how you mentioned SIBO, because I see that a lot also with my clients is mast cell activation syndrome, mycotoxins, SIBO, chronic SIBO, potentially just maybe even a lot of people that have done multiple rounds or treatments for SIBO, but then again, underlying triggers, things that might be dysregulating the immune system, slowing down gut motility, still creating an imbalance within the gut, causing that bacteria overgrowth to still stay colonized, or at least allow for continuous recolonization within the gut, just because, again, like we've been keep alluding back to, it seems like it's just got to address some of the underlying triggers as well. But in the case of SIBO, it can be hard to see what came first, chicken or the egg. And I did like how you boiled it down to, because this is typically what I see as well, is SIBO as a result of, it could be a result of a few different things, but it seems to boil down to what's creating this imbalance within the gut, or also creating a decrease in gut motility, allowing for those the bacteria to overgrow within the small intestine. And again, I always love to discuss this piece as well, is there's just different protective mechanisms along our small intestine that seem to help keep bacteria overgrowth at bay. And I love that you mentioned the migrating motor complex. And one of my favorite tips for that, is just, obviously adding in a prokinetic or something that can help support that after SIBO treatment, but also just keeping a nice fasting window throughout the day, like 4 to 5 hours, maybe between meals, a nice 11 to 12 hour overnight fast. If that works for somebody, I see that be pretty helpful as well as part of a SIBO treatment. I'm not sure if that's something you also use in your practice as well, but I've seen it be helpful.
Yeah, for sure.
Yeah. Awesome. So you had mentioned the enteric nervous system, and I want to dive a little bit just into how our nervous system can play a role in healing from mast cell activation syndrome, in supporting mycotoxin illness and healing from that as well. And so if our nervous system is feeling sympathetic, and it's very sympathetic dominant, and it's stressed all the time, the last thing it wants to do is focus on healing. So do you find limbic system retraining or any specific vagus nerve exercises, things like that, to be helpful as well as an adjunct to any of your treatment plans?
Yeah, it's more and more, this keeps coming up, and I've been directing people towards limbic retraining programs for a few years now. But I think, and you could even argue that, I would say at least 2/3 of my patients have some history of past trauma, some sort of adverse childhood event and they don't have to be major childhood traumas that we maybe historically think of like, something that's extreme. Um, I was actually, my wife and I were just talking the other day, and she was sharing with me something about successive, speaking of successive infections that we talked about earlier, but successive sort of, I guess, psychological trauma, right? If you grew up with, say, a narcissistic mother, and the child comes to mom, and she's like showing mom the picture that she drew, and the mom says, "Oh, that's great. I used to draw pictures like that when I was a child." And it kind of always goes back to the mom. Well, eventually, over time, these small little, it's like death by a thousand cuts. These small little traumas, it kind of shapes, or it can influence the, sort of create one giant trauma, if you will. And so, I used to think about two-thirds of my patients, have some sort of historical trauma, but you could argue that we all have, trauma on some level, and so most people do. Some obviously more severe than others, and how much that factors in, it's always hard to say. I sometimes think of it like, the pie. If we could, draw a pie, and what percentage is infections and toxins and mast cell dysfunction and autonomic nervous system dysfunction, and there's toxicants, you could lump it all into this pie in past trauma. So all of that, I think comes together, and people clearly do recover and heal more completely when they address, their any underlying limbic system dysfunction.
Do you have a
It's
oh, go ahead.
I was just going to say, I think it's a lot more pervasive than we recognize.
I would 100% agree with that. Do you have any particular or specific limbic system retraining programs that you'll usually direct your patients to?
Well, there's definitely the common ones that are out there, and I sort of present them to my patients, and tell them that everyone, gravitates towards one or the other, and or resonates with one more than others, and to give them a trial, and see how they do with them. But yeah, and I think we'd also discount other lifestyle things that we can do that don't have to be a formal program, but whether it's breathing exercises or meditation or a walk in the woods, like just regulating your nervous system repetitively, or being aware of it, almost like a metacognition, and catching yourself. I was with a patient this week in LA, and she's been under a lot of stress, lifestyle separation, kind of feeling displaced from her environment, and she's in this 24/7 high alert, and her mast cell stuff is, her symptoms are flaring, and she's having to take more medications, and she's trying to, thinking pharmacologically how she can intervene. And I reminded her how important it was for her to just, have an awareness of her stress, and employ lifestyle things that she can do on a, day to day, almost hour to hour, minute to minute basis, where she can really try to regulate her own nervous system without, it being some formal structured thing.
Gosh, that's so important. I'm really glad that we touched on that as part of something to just be aware of, at least just that first step of being aware of, oh my goodness, I haven't really been taking care of my nervous system, or just taking that second to, or a few minutes a day just to re-regulate your nervous system and get it back into that healing space. So yeah, that was wonderful.
Yeah.
So let's dive into then testing for mycotoxins. So once you're um, identifying that this is potentially a trigger or a root cause or whatever it may be for one of your patients, what's your favorite testing method, or methods potentially for identifying mycotoxins within the system?
Well, I've gone full circle and have used a lot of mold and mycotoxin tests over the years. When I first learned about mold illness, and from Dr. Joe Brewer, back in 2013 at this Lyme conference, he was, I think at the time, he was using real-time labs, and it might have been the only urine mycotoxin test available at the time. And I was used real time for a number of years, and then ventured off and did use SIRS markers, Dr. Shoemaker's SIRS markers for a number of years, and those were insightful. I think they were helpful. Sometimes they could, but as most people realize, they're non-specific markers, and so um, are they a reflection of a chronic inflammatory response syndrome? Sure, they are, but they're not specific to mold. And I think the problem that a lot of physicians recognize was we would see some of these markers elevated with other conditions like tick-borne infections. Um, I have used mycotoxin antibody testing for a number of years. I've, kind of have done split samples or used uh, multiple methodologies at the same time. So measuring urine mycotoxins and mycotoxin antibodies at the same time. Um, I'm I've gone full circle, and I've been using real-time labs exclusively for the last few years, and I'm a big I really believe that you have to provoke the sample. Um, with real time and doing that with glutathione. Ideally we do it with IV glutathione. So when I see new patients, if we're going to do a test, we often will give them a glutathione IV push while they're here, and then they collect their urine the next day. If they're unable to do the IV or they're remote patients, then they'll do oral glutathione or find someone locally where they can get the IV. Um, More recently, I've been having patients not just collect their first morning urine, but collect a 6-hour urine sample. So their first morning urine, and then the following 6 hours, any urination into a jug, and then essentially mixing it up and pouring off a sample container to send to the lab. And that might there was a great talk at I'm on the board of an organization called International Society for Environmentally Acquired Illness, which is a mouthful. we call it ICI for short. And there was a wonderful talk at our fall conference about the different lab tests available, and there's some evidence that these mycotoxins may continue to be released in the urine, beyond that first morning urine sample. So I like, right where we are right now is provoking with IV glutathione, collecting the following day's first morning urine and the following 6 hours, and using real time.
I have to say, real-time labs is actually my favorite form of identifying that as well. So I'm glad we're on the
Yep.
same page.
Yep.
One of my final questions is, so after identifying the type of mycotoxin that's present within the body, and then, utilizing binders, different types of binders to support in binding, these mycotoxins out from our body, I would like to just circle back to, once we've cleared the body, we've talked about, healing the body at such a cellular level because of the damage that these toxins can really do to our system. So I was just curious of a couple of things that you like to implement with your patients that you found really helpful, that helps to start to support the body at that cellular and mitochondrial level.
Yeah, this has become a real big part of my practice, and it's an area I have a lot of interest in, it, and we've been sending blood to a lab in Germany to look at basically measure mitochondrial uh, function or structure, and measures other cellular components that kind of give us an idea of how much of that collateral damage has occurred. And from that, sort of getting a baseline prior to treatment, and then use a IV protocol that uses phosphatidylcholine as one of the main ingredients, and so we administer a lot of phosphatidylcholine with our patients, and if people are unaware, phosphatidylcholine is a phospholipid, and it's one of the primary phospholipids that makes up cell membranes, and of course inside of cells you have organelles like the mitochondria, and their structure is also made up of these phospholipids. So if the car has been run up against the railing on the windy road, then the phosphatidylcholine is what really comes in and helps repair the cellular damage. People often ask, we get this a lot through either social media or my website, but people will want to know, like, well, does oral phosphatidylcholine do the trick? And it definitely helps. I think it can be helpful, but ultimately what I see, because we can sort of objectively measure before and after treatment with a lab, that people do need sort of higher volumes that can only be accomplished with IV administration. And so then I end up retesting afterwards, and you can really see the improvement in cellular health and mitochondrial structure. Something called DNA adducts are also measured in the lab, and we can see the DNA adducts being cleared from the phosphatidylcholine treatment. So we have it's a whole IV protocol with multiple bags that are dripped in, and we're having really good success in our patients with complex illness.
Gosh, that's so wonderful to hear. Well, thank you so much for all this amazing information. I know I learned quite a bit from you, and I'm really excited for everyone else who will be tuning in to hear everything that you have to say. I always just like to ask it at the very end of the podcast, just if there's anything else that you'd like to leave the audience with, or if there was anything else that you wanted to mention that I didn't ask.
Good question. I ultimately, kind of something we discussed earlier on is that I giving people hope and letting people know that they can heal and recover. I think, what we see all too often on, whether it's in patient groups, online, or on social media, is, people talk about just getting by, and, and it's fine. There's, clearly a lot of people that have attempted to heal and recover over the years, and they're maybe haven't fully recovered and they're struggling. But I do believe that everyone has the opportunity to heal and recover and get better. It's really just a matter of taking an approach of identifying, what's causing their symptoms to persist or what's interfering with their ability to heal and recover. And but it is possible. And so final message is stay optimistic and hopeful that you can recover.
I couldn't agree more, and that was such a positive note to end on. So thank you, Dr. Maderis, for joining us today.
Thank you for having me.